we go, Sloaney 700 WLW. We're going to jump right in. We've got lots going on today, including benefits enrollment season is now over, right? The window has closed. You went through all that stuff and maybe paid a little more or changed your plans, and now you settled in for 2023, and bam, that's how they get you. The reality is setting in for millions of people. Some horror stories coming out for those choosing the high deductible healthcare plans. You do the high deductible and that's less money a month. And then you hope nothing goes too bad because then your deductible's high. Well, what could go wrong? Look at the case study here. Shows a family who is paying $120 a year. They needed a 4-pack of EpiPens. And the EpiPens, as you know, there's been controversy over that for a little while, but you need that. If you go to anaphylactic shock, and that'll save your life. So they switched plans, went high deductible, and now they went from $120 a year to $2,400 a year, which means, and they said this is, just an outlier, not an outlier, but there are literally thousands, if not many more people who are choosing not to get their medications because they chose the high deductible healthcare plan, and now they're locked in for the year, and now we got problems. Joining me is our healthcare expert, and he's a managing partner of PCS Healthcare Advisors. That's Paul Seegert. Paul, welcome. How are you?
I'm great. How are you today?
I'm doing fine. So what's going on here? I mean, is it a case of reading the fine print, or people just look at it going, wow, I could pay this much a month. I could lower my monthly premium down, hoping I don't need the health care. I'm assuming all my prescriptions are covered. And if I have something catastrophic happen, yeah, I know I'm going to get hit and pay more. But obviously people are not expecting these high prescription prices.
Well, a couple things going on. One is, yes, buyer beware. As consumers, we don't spend a lot of time, and hey, who likes insurance? We don't spend a lot of time deciding what plan we're going to pick for the next year. I think last time I looked at it, it was about 15 minutes, and my spouse spent all day, one of the days this weekend, the entire day planning a vacation. So that's kind of normal. And then the other issue we have is that the thing we don't talk a lot about is the fact that through this Affordable Care Act of Healthcare, we've shifted a ton of cost to consumers in out-of-pocket risk in their plans. Deductibles have grown 87% since the Affordable Care Act kicked in. So we've created plans every year. The deductibles grow, the max out-of-pockets grow. We've got HSA-style plans where nothing is covered until you hit a certain number, which is, I believe, what's probably happening in this case study and what many will face. You may have lower monthly costs, but what if you have a prescription that costs, like, it could be like this, but it could be much worse. You could have a prescription that costs $5,000 a month, and you're on the hook until you hit your deductible to max out of pocket.
Yeah, that's the concern, right? Is just that. Okay, I'm not expecting anything bad to happen, but I should know what my prescription costs are. And so why are we seeing this creep up then? It used to be $30 for a prescription, a basic copay, and now you're talking hundreds, if not thousands of dollars. What's driving this increase?
Well, they've created these plan designs where you are for the drugs until you hit your deductible. And that is putting a spotlight on the fact that these drugs are priced wildly. Many of these drugs are priced wildly high. And you were insulated from it as a consumer when you were just responsible for copays, which I think kind of highlights the whole problem we have in our system, period, is that we don't consume based on actual cost. We consume based on our cost, our copays and deductibles, which makes sense, but they don't correlate to real cost. We've had 4 drugs come out since August that are over $2 million per patient that receives them. I mean, there's just so much that the consumer doesn't know, so then they're not in a position to make good decisions that easily because we've hidden so much of the real cost from them because the system wants to drive cost up, but doesn't want the consumers to see that, of course.
Paul, is also the problem here is, okay, Affordable Care Act, and people who use it like Affordable Care Act. That's why it's still here. It's not gone away because people like it. However, what happens is I get an Affordable Care Act plan. We know that kind of like Medicare, right? The costs, and because the government is a bulk purchaser, they'll drive to keep the costs as low as possible. That means that healthcare providers or pharmacies will just bill those who have private health insurance more to make up the difference, to make up their margins, and so they're compensating, right? And so what happens is they raise the cost for people who have private health care insurance. I'm guessing this case study, the studies are people who have private health care insurance to their employer, and they go, okay, well, we're losing money with ACA and Medicare. I guess we'll just shift the cost to those in private health care. So that's why we're seeing the numbers go up. Is that true?
That's the quality of our system, absolutely. And it makes me even more scared when you see this stuff come out about Medicare negotiating drug pricing. I know that sounds sexy and sounds great, but there's that rule that says we can't just be squeezing a balloon and shifting more costs to private payers and commercial payers, which is absolutely what I expect to see if Medicare goes to a drug manufacturer and says, hey, we're going to take your blockbuster drug that's $10,000 a month, we're only paying you $2,000, or you have to pay us 95% of your revenue as a little surcharge. What are they going to do? They're going to turn around and say, hey, employer plans, that's now $20,000 or whatever.
Right.
There's nothing to stop that, which has historically been the case. They don't just sit there and say, no problem, we'll reduce our revenue by 80% on a blockbuster drug.
That's not going to. Well, there's a new drug out now that I was reading about, right? That it's supposed to be the miracle pill for weight loss or something like that, if you know what I'm talking about. And the cost of that thing is going to be, it's like $1,000 a month. But you're talking about, essentially curing diabetes and a whole bunch of other things. That's going to be the next wave of it's unfair that this pill cost all that much, despite the fact that pharmaceutical companies and R&D facilities have been working on this thing since the dawn of time.
They just yesterday, the American Academy of Pediatrics has changed their guidance, and they recommend medication for weight loss for children that are overweight and surgery. Which is to me a huge event in our system, because look at our population. Of course, everyone is aware of the fact that we've been getting heavier, bigger. We're overweight and obese at super high rates, highest in the world, and we don't focus at all on lifestyle and prevention and all the things that create the problem. We're America here. Yeah. We want to take a pill to fix it.
Right.
This has the potential to be. I started to write an article on this yesterday. To me, this is the biggest event in healthcare since the Affordable Care Act or the COVID vaccine. This has the potential to be the best-selling class of drugs of all time. We could easily, in 5 years, push $100 billion of cost into the system. And then what? That was the premiums then. And will the government pay less? Yes. Will the private payers pay more? So we just continue to squeeze the system and squeeze consumers. And, it's kind of sounds like I'm stereotyping to say, but we're just saying continue to play video games and take a pill. We'll fix this problem. We got a pill for that.
Paul Seegert from PC Healthcare Advisors on the show and talking about the copays now that the reality of your new plan is kicking in, and those choosing the high deductibles are now feeling the wrath because your prescriptions for life-saving drugs, life-sustaining drugs is going up to the point where you can't afford it anymore. But there's a new class of drugs on the market that the FDA hasn't quite greenlit yet. I don't think they've okayed it, but it's apparently a fix for obesity in America. It's a pill. And I was a joke for years. Every time I'd have someone in healthcare, I said, listen, we're doing medicine a favor. If we continue to eat like we're on death row and treat our body like an amusement park, eventually medicine is going to find a cure, and it's going to be in the form of a shot or a pill. And I'll be damned if not years later, that's come to fruition, because there's a lot of money in that thing. And so basically, if you're a fat bastard like me, you are doing the world a favor. How about that, Paul?
Well, you're doing this industry a favor. I'll tell you that. You're making more billionaires.
Right. Well, but here's the thing, right? Now, this may actually, this in a way, because you're talking about the cost of that pill being $1,000 to start, but anything new, right? It's the first calculator, the first computer or watch. It's always the people with a lot of money that wind up driving that innovation that eventually reduce the cost. They're the ones that can afford it are the wealthy, and then eventually, after a few years, the cost of that drops, right? Because of the economy of scale and a bunch of other things. So what I'm saying is eventually that price will come down on those pills. But on top of that, I think if a lot of people, I like statins, right? I don't know, is that the most widely prescribed drug now, statins or blood pressure medicine, stuff like that? Yeah. If now all of a sudden people are losing weight, which is causing all these other diseases, doesn't this magic pill then for weight loss fix America's healthcare problem?
Well, you know what? That's certainly the argument, and that's what they're going to pitch to the regulators to get this approved for this. And I bet they'll succeed at it. And then once they get it approved, then it becomes a question of will insurance cover it? They'll probably succeed at that. And to me, that this is a scary, scary math conversation we're having. Mm-hmm. And it's not, there aren't just two options. It's not just, I mean, maybe in a practical sense, can you do the math and say, if we put everybody on this pill, will we reduce diabetes? Will we reduce the heart disease, all these things? Yes. Could we also promote a healthy lifestyle and do some other? It could also be that there's no pill for it and we could solve it.
Yeah.
And we really do have to have that conversation. I understand that sounds impossible, but there isn't an unlimited supply of money that we can keep pumping into healthcare so that we can all continue to be, not be responsible for our health.
Yeah. Yeah, I mean, I can see, somebody's going to have a bowl on their coffee table full of these pills, and they're going to get a handful of those, and meanwhile be sitting there with a 5-gallon bucket of mayonnaise and a spoon going to town. So it's like, wow, I just wiped that all. I'm great. Everything's good. That's what we do. We're Americans. We find a way to break stuff like that. Come on. Just eat mayonnaise out of the jar like a dog. Yeah, it really is. Paul Seegert, PCS Healthcare Advisors, talking about benefits enrollment season now officially and the decisions we made in the fall regarding our family's healthcare insurance. A lot of people want high deductible because you look at that monthly rate and go, man, it's pretty enticing. I'm going to pay less a month. If I can stay healthy, I'll be good. But now we're getting hit with these incredible prescription drug bills for people on the high deductible plans, and it's not sustainable because people are going without their medicine. So what do you think happens? People wind up who got the high deductible plan wind up changing in the fall this year, or what?
Well, yeah, some of them are locked in all year. Many of them will be kind of stuck in that decision. And education costs money, unfortunately, in lots of cases. Yeah. And this is a form of education. This has become such a big decision that you make each year. And sometimes you don't see it because of how much of the premium your employer pays. But you're spending now to cover a family. You're buying a Honda, like the Honda Civic every year, or a Honda Accord every year to cover your family for health insurance. You need to really look at it closely. I mean, it's not at all uncommon that you could spend north of $20,000 up to $30,000 to cover your family on health insurance, combined what you're paying, what your employer's paying. And by the way, if we could contain this a little better, then maybe your employer could pay you that money instead of sending it to an insurance company. I mean, we've taken the consumer so far away from the reality of what's going on purpose. The whole part of our economy wants this lack of transparency. I mean, they benefit very well. It's a huge benefit to our healthcare, medical industrial complex to just keep people in the dark. It's only $10. No, they're charging your health plan $4,000 for the drug. Right.
And Congress isn't a help either because they could go, it's funny. You see this Affordable Health Care Act, and we need more and expand it. But no one in Congress, Republican or Democrat, as far as I can tell, that are talking about going, hey, wait a minute now. What about people on private health care and how they're getting squeezed out of it? I've not heard anyone talk about that politically speaking.
No, and that, to me, the two biggest things going on in healthcare right now is the weight loss drugs we talked about that have the potential to drop a bomb onto the system in terms of cost. And then what you're pointing out now, 20 years ago, 2 out of 3 of us got our healthcare at work. So that propped up the whole system because commercial payers pay more for the same service at the same facility as compared to government payers. This is why rural hospitals are closing. It's why nonprofit hospitals in poor areas are moving out and moving into richer areas because they can't survive on Medicare and Medicaid. They need 120 to 140% of what they collect oftentimes just to break even. That used to work because so many of us were going to walk in with a commercial payer card in our wallet, and they could bill us 2, 3, depending on the state you're in, 5, 10 times what they charge those government plans to make their profit margin. Right. We're now down to 49% of us that get our coverage at work. That, to me, is a major milestone in our economy, that 49% of us now get it at work. We're pricing out small employers. They're looking at it and saying, why should I spend all this money to give my people a subpar plan that then they're going to spend $5,000 to $10,000 when they need health care out of their wallet? I should just shut this thing down, let them go to the exchange and get a subsidy.
Right. Yeah. I mean, and that's where we're headed. So it's going to get worse before it gets better. If it gets better, Paul Seegert, PCS Healthcare Advisors, managing partner. Thanks again for the time, buddy. I always love having you on the show.